How do healthcare providers monitor treatment effectiveness for bladder conditions? When it comes to bladder conditions, healthcare providers have a variety of methods to monitor how well treatments are working. They use a mix of clinical evaluations, laboratory tests, imaging studies, and endoscopic procedures. This comprehensive approach helps ensure that patients receive the best possible care. One of the first steps is clinical symptom assessment. Providers regularly check for symptoms like urinary frequency, urgency, pain, hematuria, which is blood in the urine, and urinary retention. If patients notice improvements or a reduction in these symptoms, it often suggests that the treatment is effective. Urinalysis is another important tool. This test helps detect blood, infections, or abnormal cells in the urine. For instance, if a patient has persistent protein in their urine, they may need to be monitored every 3 to 6 months. This helps evaluate both kidney and bladder health and how well the treatment is working. Additionally, urine cytology can be used to find cancer cells in the urine, which is particularly useful for monitoring bladder cancer. Cystoscopy is a key procedure that allows healthcare providers to look directly at the bladder lining. This test helps detect any tumor recurrence, inflammation, or other abnormalities after treatment. For patients with bladder cancer, cystoscopy is routinely performed to check for tumor recurrence, especially after procedures like transurethral resection of bladder tumor. Imaging studies also play a crucial role. Techniques such as ultrasound, computed tomography, and magnetic resonance imaging help evaluate the bladder and surrounding structures. These imaging tests can identify bladder masses, assess tumor size, and detect any metastases. If anything suspicious is found during cystoscopy or imaging, providers may take biopsy samples. This helps confirm whether cancer cells are present and assess how well the treatment is working at the tissue level. For bladder cancer treated with intravesical therapies, where medications are delivered directly into the bladder, healthcare providers monitor treatment tolerance, side effects, and recurrence rates. They also keep track of how well patients adhere to therapy, including any home-based treatments. Lastly, if bladder conditions coexist with other health issues, such as kidney disease, providers closely monitor renal function during treatment. This is especially important when using intravenous antibiotics or other systemic therapies. In summary, monitoring treatment effectiveness for bladder conditions involves a thorough approach. By combining symptom tracking, urine tests, cystoscopy, imaging, biopsy, and laboratory monitoring, healthcare providers can ensure timely detection of treatment response and any complications. Regular follow-ups with healthcare providers are essential for optimal bladder health management.